How can you treat an insect bite at home? I got an insect bite last night and you can see it just here. And the first thing you need to do is to wash the bite with soap and water, and this helps to clean the area. The next thing you need to do is run any cool water over the bite to help cool down the skin. And then you can either get an ice pack like this or a bag of frozen vegetables. Here I have a bag of frozen peas. And then put that in either a towel or a pillowcase or in a t-shirt, and that will help protect your skin from getting a skin burn. So I'm going to put this ice pack into a towel and then place that on the skin to help cool down the skin, to numb the area and get rid of the itchiness. After that, you can apply some cream. So there are 3 types of cream which can help reduce the itchiness. The first one is mepyramine malate, and this is for adults and children over 2 years old. You apply it about 2 to 3 times per day and for a maximum of 3 days. This will help to get rid of the itchiness because it has an antihistamine in it, again called mepyramine malate. The other cream is crotomiton cream. So you can apply this again 2 to 3 times a day, and it's for adults and children over 3 years old, and it will help to reduce the itchiness. There's also hydrocortisone 1% cream, and this is for adults and children over 10 years old, and you can apply this once or twice a day and for a maximum of 1 week. You should not apply hydrocortisone cream anywhere on the face. Once you have decided which cream you want to use, you might want to consider taking an antihistamine by mouth. So this would be either a tablet or liquid, and antihistamines include acrivestin, loratadine, cetirizine, chlorphenamine, and also fexofenadine. You can take the antihistamine however it needs to be taken. There are daily antihistamines where you just take them once a day, and those include fexofenadine and loratadine and cetirizine. And there are other antihistamines which you can take multiple times a day, so normally every few hours, and these include chlorphenamine and acrivestin. So when you take antihistamines, they can lead to some side effects like dehydration, so you want to make sure you drink plenty of water, and sometimes they can also make you sleepy. So just be aware that those are some common side effects of antihistamines. So other creams that you might want to apply to your insect bite include antiseptics. So I've got 2 different types here. One is Savlon and one is Germaline. And you want to apply an antiseptic just to try to avoid the insect bite from getting infected. If you do itch the bite and it does start to become very red, hot and swollen, or the rash starts to spread, then these are all signs that it could be infected, and you need to see a doctor or pharmacist as soon as possible to get the treatment that you need. If your hands are dirty and you're out and about, you might want to try applying a cooling spray like this. So that just helps to provide a cool area around the insect bite and to stop it from itching. And that's if you have that in your first aid kit and you are outside on a walk, maybe hiking or trekking. So if you start to get any pain from your insect bite, because sometimes they can be painful, you can take either liquid or tablet paracetamol, or you can take ibuprofen as well. And ibuprofen helps to reduce the swelling and also take away any pain, and the paracetamol is just to help to take away the pain. It doesn't help to reduce the swelling. Always speak to your pharmacist or doctor before you use any medicines, especially if you want to treat an insect bite on a young person. Thank you for watching this video, and I hope you have a lovely day.